Hello, my name is Portia Purley, and today I'm going to be talking about nursing burnout. We'll start with just an overview of burnout. Burnout is a significant issue facing nurses across the world. This includes RNs, patient care technicians, nursing students, and more. It's caused by the body's reaction to chronic stress related to work. Job responsibilities as a nurse are very intensive and involve high concentration, quick thinking, and emotional control to deal with issues at work and patient death. These factors can lead to work overload and cause chronic stress, ultimately leading to burnout. So it's important to note that burnout can look different for most individuals, but there are a few key characteristics. These are emotional exhaustion, likely due to the high stress nature of the job, depersonalization, which is a lack of empathy or caring, and job inefficiency, which is poor productivity and low quality of care. Now let's talk about some causes of burnout. Some causes are job frustration, job overwork, poor work-life balance, substance use issues, emotional or family problems, and workplace bullying. Luckily, there are some techniques to prevent burnout. First, making changes in the hiring process, such as taking more time to get to know the person to ensure that the person hired has the same value that the hospital or unit has. Having an open door policy. Creating an open door policy allows staff to check in when there's a problem. This opens up a communication pathway between managers and staff and would allow leaders to address problems in a quick and efficient manner. Next is ensuring that leaders in the work field, such as charge nurses or nurse managers, recognize the signs of burnout and job stress in order to combat symptoms and provide early intervention. Next is ensuring that staff take their scheduled breaks. Oftentimes, staff members will clock out for breaks without actually taking them or make their meal times a working break by eating quickly as they chart or completing smaller tasks. This further contributes to burnout. Ensuring that staff takes their scheduled breaks allows them to take both a mental and physical break and reset before going back out onto the floor. Next is having leaders provide support for regulatory compliance. This helps the nurses on the floor to complete tasks in a timely manner and can significantly reduce stress, lowering the risk of burnout. Last is observation. So having leaders observe staff behaviors on a regular basis to discern signs of burnout. Again, this helps to combat issues early and provide early intervention to alleviate burnout symptoms. Next, we're going to talk about the outcomes of burnout, which is a significant thing to address when talking about nursing burnout. So the outcomes of burnout are decreased focus, lack of compassion for patients, decreased quality of patient care, decreased patient satisfaction, safety risk to patients, and increased risk of errors. These all tie together. Decreased focus and lack of empathy can lead to decreased quality of care and increased risk for errors. The biggest thing to look at this is the safety risk to patients and the increased risk of errors. This is the biggest concern because we know as nurses that safety is always the biggest priority in nursing and any healthcare field. The outcome must be addressed immediately to prevent harm and bad patient outcomes. Last, let's talk about interventions for burnout. First is a survey to identify staff burnout. This allows leaders to see firsthand if nurses on their floor are burnt out or overly stressed. After reviewing the surveys, leaders will be able to make a set plan based on the responses to combat burnout on the floor and implement further interventions. A mindfulness-based stress management program can also be useful. It uses a specific criteria to treat burnout symptoms. Smartphone-based stress management programs or internet-based cognitive behavioral therapy is an important resource because it allows nurses to have easy access to a therapy program. And it also gives them more time so they don't have to schedule their shifts based on when they have therapy. They would be able to access it more easily. Aerobic exercise provides a set workout schedule, which can help by providing a physical release of stress. And emotional regulation training can help with the depersonalization and the emotional stress of the job. In conclusion, nursing burnout is a significant issue caused by chronic stress from job responsibilities. Outcomes are significant on the well-being of nurses, and intervention should be implemented promptly to both prevent and treat burnout in nurses. Thank you for watching.